So, if I've been suffering from neuropathy for years and I've been to
Mhm.
medical doctors, I've been to podiatrists, I've seen
Yeah.
specialists, and I still haven't gotten the relief from my symptoms.
Yeah.
Do you really feel, Dr. Eric, that I still might be a good fit and you may be able to help me?
The short answer is absolutely or yes. And the longer-winded reason behind that is because we know a few things about peripheral neuropathy. One, it is a progressively degenerative condition, which means, in the simplest of terms, it gets worse over time. With that said, what we don't know is the rate at which it worsens. Meaning, if I would say know a patient from church or from the supermarket or just casual acquaintance, and I knew they had neuropathy, I might ask them how they're doing. And let's just say they're not a patient, but they're undergoing perhaps symptom reducing, but not curative treatment, taking prescriptions per se. And I may speak to them 6, 8, 12 weeks later, and they are drastically worse than they were only a month or two ago. Or there are times where I could speak to someone a year or two later, hypothetically, if they weren't a patient, and they could be only incrementally worse than they were a couple years ago. So the rate of the worsening is something that medicine doesn't have necessarily a handle on. A lot of it has to do with the fact that it matters how old someone is. It matters what type of disease process they are fighting. It matters what type of genetic predisposition they have. I may have mentioned it, if I apologize if I say it again, but lifestyle plays a large role. If you drink alcohol excessively and you don't plan to stop drinking alcohol, there's little or no chance that you're going to help your neuropathy on your own. But we do know if you stop it, it may not stop the worsening of it, but if you continue said behavior, it's going to worsen a lot faster. So I often tell patients who are discouraged because they've had peripheral neuropathy for years or decades that it isn't necessarily how long they've had it, but how severe the damage is. And it isn't even exactly what the reason is, whether it be chemotherapy or diabetes or the 30% who have no idea why they have it. But again, it's how much damage has occurred at the time that they present for treatment. Some patients have it weeks or months, and they are literally tripping over their own feet. They could hardly sleep. They're dropping pens and pencils. And then I have others that have had it or been diagnosed for years, and they are suffering quality of life issues, but they are still manageable and improvable. So I don't discourage patients who've had their condition for years or decades to seek out an evaluation, because we're going to be able to bear out whether or not the damage exceeds the ability for us to help them. And that is not dependent simply on time.